Dr. Tim Shacker, the U of M Medical School's Vice Dean for Research, and then Dr. William Maurice, who serves as President of Mayo Clinic Laboratories. Dr. Shacker just said something. This was a pretty interesting fact he gave me. He said it was 150 days ago that I think you said they sequenced the virus for the first time. Meaning for the first time, we had that data that we needed on a deep detail 150 days ago. And think of the change that we've come through. It was during the last weeks of April where it became apparent that a disconnect between the federal responsibility on testing and the state's responsibility was causing a problem in the United States, that we were lagging behind in testing. And most of the researchers understood that the only way to control a pandemic was to, first of all, know what you're up against, who has it, be able to quickly identify those folks through testing, be able to quickly do contact tracing to who they've come in contact with, and then have a quarantine strategy that would be able to respond as this lasted its entire lifetime. At that point in time, we were, like many states, trying to keep up and catch up with that testing. So we called for the Minnesota moonshot that said, and my goal was to try and get us in the first week in June, to be able to test at a capacity of more than 10% of our population to be tested, and to have the daily capacity to test 20,000 people. It was incredibly ambitious in many ways that none of the structure had been created yet. None of the supply chains were functioning correctly because there was a lot of disruption globally and in the United States, but it was a commitment by the University of Minnesota, the Mayo Clinic, our other health systems, and the state of Minnesota to create our own system to supply that was independent of those supply chain breaks that would make that case. And I'm here today to announce that we have reached those goals. We have tested over 500,000 tests have been given in Minnesota. It'll actually be a little over 600,000 today. And we do have the capacity now to test 20,000 Minnesotans every given day or on any given day. On the day that we announced that, I thought it was really important that I got asked a question: if we don't get there, who's responsible? And I said, me and me alone, because the responsibility to organize this fell with the state of Minnesota and the governor. But I want to be very clear. The reason we reached those goals was not me and me alone. It was about a collaboration amongst our great institutions like the University of Minnesota, the Mayo Clinic, and all those other health systems, plus the work of suppliers, both inside state government to supply chain and access those reagents and the supplies needed, and the expertise that came from the private sector of people that came over when Doug Baker and the Ecolabs folks lend us people, that we had some of our great companies lent us a team that put together to be able to do that. And what that has done is it put us in a position to be able to have an accurate representation of where the virus is at in Minnesota. It's allowed us to think about strategically going forward where we could test all of our long-term care facilities. It has given us the ability then to start building up the contact tracing to match that testing volume. And we said this back in April, that the reason for it is we're going to need to be able to test, trace, and isolate until we have therapeutics and a vaccine. And at that time, we were talking 18 months potentially. I think that time frame still probably falls correctly, and that's where we wanted to be. So Commissioner Malcolm will talk about this. Our cases have plateaued. While we're testing more, we are, of course, finding more. And I want to be clear, just because you test more isn't why you have more positives. My analogy was, if that were true, I would just take the scale out of my bathroom and everything would be fine then, because the testing is not what causes the positivity. What you're able to do is have a clearer picture and a broader footprint as we started to sentinel test. And with doing that is some of the things Commissioner Malcolm will talk about is we're looking at daily positive rates of those tests. Whether we test 10,000, 15,000, or 5,000, the percentage of positives in that gives us a good indication of the spread of this. Today, we are at about 4.18%. It was a little bit of a tick, but we've been going a little bit up and down. That's significantly better than, for example, in Arizona, where they're at 14%. So when they're testing, no matter the volume you test, that's what they're getting. So I can tell Minnesotans that we have one of the major tools necessary to weather the long haul of this vaccine, with a robust testing infrastructure that was built in a very Minnesota manner. We called it the moonshot. On that case, we are off and running. It's happening. And now what we need to do is continue to partner that with the things we know make a difference. The social distancing, the wearing of masks, and the smart reintegration of our economy, and now having the capacity of something that I continue to say, it's not good enough to open your economy if you can't keep it open. And one of the tools you're going to need, if you go and look at states that are having problems right now, their percentages of the population that they tested is about 5% or 6%, instead of being at the 10% they need that starts to bend that curve. So this was smart strategy. It was through the partnership of these great institutions. It was a commitment by the state and a whole lot of people. And I'm going to add one more thank you in that, just the capacity to do the test. We counted on the Minnesota National Guard, who are out there doing a lot of these testing, especially in long-term care facilities. It gives us more capacity as we train people up. So it's a good day in that regards. As I again said the first night I addressed from the residents in a nighttime address, when we talked about the long winter of COVID that was coming, we're still deeply into that winter. We are not out of this as the nation is seeing it, but I think Minnesota's approach to this gives us a better capacity to weather over the long haul and continue to have more things operating and more people doing the things that they want to do. So with that, I will turn it over to Commissioner Malcolm to give us an update as of today.
Thank you, Governor. Good afternoon, Minnesota. Well, over the weekend, the world passed some very unfortunate milestones. Over 10 million people have been infected with COVID worldwide, and over 500,000 have died. In the United States, we are at more than 2.5 million cases and 125,000 deaths. Here in Minnesota, we are now at a cumulative laboratory confirmed case total of 35,861. That was up 315 from yesterday. Sadly, we also reported 10 additional deaths yesterday, bringing us to a new total of 1,435 deaths in Minnesota from COVID-19. The hospitalization picture remains good, stable. 10 fewer COVID patients were hospitalized yesterday compared to the prior day. 278 people are in the hospital as of now, with 140 of those in the ICU, which makes it the lowest level of ICU capacity or utilization rather since May 1st. So we have seen significant improvements in the hospitalization picture. As the governor mentioned, and I've mentioned in the past, we continue to see this peak and valley pattern. Saturday's peak of 520 new cases was the largest we had seen in some time, the largest number since June 4th. The 235 cases that we saw about a week prior was the most recent valley. So we are seeing this up and down pattern. But keep in mind too, that what we're seeing in case counts today reflect exposures that happened 2 or 3 weeks ago. So we expect our daily numbers to continue to fluctuate, and frankly, probably to go up a little bit as we see the results of increasing interaction in the community, particularly as we're seeing more social gatherings and we're seeing second generation transmission of people who may not even know that they've been infected to other people who will show up in our case counts in a couple of weeks and in hospitalizations a couple of weeks after that. So sadly, we are all a part of this transmission chain and all need to act accordingly. As the governor mentioned, the number of cases per day is very dependent on the number of tests per day. So we like to keep track of the case positivity rate, as the governor mentioned. That too fluctuates a little bit from day to day, but the 7-day average positivity rate is 4.4 at this point. So we're watching week over week. Another interesting metric, I think, is over the last week, we tested on average 11,240 tests per day. And that volume was an increase of 16.4% of tests per day over the prior week. During that same time period, new cases increased 7.9% a day. So you can see the good ratio there between testing more, but finding fewer cases. So this is, as the governor said, a better way perhaps to keep track of what's going on than just looking at any one day in isolation. So we're here today to talk about the importance of testing in our strategy going forward. And I want to thank the university and Mayo for being here today and for stepping up with our state's health systems to make this partnership and this moonshot happen. This work really shines a spotlight on the world-class healthcare and public health systems we have here in Minnesota. Our institutions are very well regarded individually, but when they work together collectively, as they are doing in this partnership, the results are really powerful. In addition to the extraordinary work that these partners have put into caring for patients with COVID-19 and preparing to care for the possibility of many more cases in the future, they've stepped up to serve in other ways, working with us not only to increase testing capacity, but to work to remove the barriers to testing that people encounter, vexing issues like billing and changing guidance about priority populations to be tested, trying to make that as seamless as possible for people so that people can get the tests they need and the follow-up care that they need. We're very proud of Minnesota for reaching this milestone today. This means we can test who we need to, where we need to, when we need to help people make decisions to protect themselves and their loved ones and their communities, that we can identify hotspots as they're occurring and quickly target our efforts to slow the spread, to see how we're doing statewide and where we need to change course. And we do know that the testing capacity does and will vary from day to day. For example, the global supply chain issues are still with us. Individual health systems are running into reagent problems periodically. Machines are being shipped less quickly than they were anticipated to be. So the steady progress toward this capacity is truly impressive, and it does reflect a lot of hard work to just keep tackling the next issue as it arises. But with this capacity now to test 20,000 people in a day, this puts us in a position that many other states don't have. When I talk to colleagues around the country, it's without question that every governor has said we need to test more people, and that's been the goal. But the ability to actually execute on that goal has been full of challenges for literally every state in the country. I think our progress has been more durable because of the partnership that we've established here. And when I talk to colleagues about what the idea behind this statewide system, and being able to work with world-class researchers to make sure that as we learn more, we're testing smartly. We learn how to use the right test in the right circumstance at the right time to give us the best information to not only treat COVID, but to understand how to respond to prevent community spread. But as a state, we're only as good as our individual actions. This incredible capacity that we've built doesn't frankly do us a lot of good unless people seek tests and get tested. So we're, again, just strongly encouraging people, especially as we come into an upcoming holiday week, that if you're feeling ill, please get tested. If you are concerned about an exposure you might have had, even if you don't have symptoms, please get tested. The CDC has fairly recently updated their guidance to encourage testing of asymptomatic people who have reason to believe they may have been exposed. So as the governor has already said, this testing capacity gives us the ability to respond to whatever comes next. And we know that there will be ups and downs. We know there will be increasing cases. We know we need to always be vigilant to look for community outbreaks and to be able to respond as quickly as possible. So with that, I will turn it over to Dr. Shacker from the University of Minnesota Medical School. Dr. Shacker.
Thank you. Good afternoon. Governor Walz, Commissioner Malcolm, welcome to the University of Minnesota. You're standing in the Cancer and Cardiovascular Research Building, which is really the entryway to the Biomedical Discovery District of the university. The building just behind us over here is the Microbiology Research Facility. Early on in the epidemic, we repurposed the entire first floor of that building to be able to expand the testing capacity. So the research labs that are over there are now part of our COVID testing lab. Just around the corner over here is one of the laboratories of the University of Minnesota Genomics Center, which is part of our testing strategy. Under the direction of Dr. Beckman, the tests are resulted there. So all of the capacity that we've built for the PCR, for the molecular testing, is happening in these two buildings. Just to the west of here is the Wallen building, where the Center for Immunology is. And that's where Dr. Jenkins and his team developed the antibody test that we use for the serology to be able to measure past infection and to look at levels of antibody. And that's actually where our research is focused right now on what do these antibodies mean, how protective are they, and how can we leverage those tests to provide better care. The University of Minnesota is committed to COVID-19 testing and this partnership. This helps us to fulfill our land grant mission of serving the needs of all of Minnesotans whenever and wherever we are needed. And we are up to the task and we will be there. On behalf of the university, I'd like to thank Governor Walz and Commissioner Malcolm for the support that has been provided to the university that has enabled us to do all of the work that we've done over the last several months, to be in the position that we're in, to be able to help the people of Minnesota. So now, those are my remarks. I'd like to invite Bill to come up and give a few comments. Thank you.
Thanks, Tim. First of all, it's a real pleasure and honor for me to be here this afternoon. Mayo Clinic and Mayo Clinic Labs, really honored to be part of the solution for the state. Also very thankful to the governor for your leadership and Commissioner Malcolm. Very, very appreciative of that. And most of all, I'm really thankful for the spirit of Minnesotans. Having been here for 32 years, I know that the great establishments like Mayo Clinic and the University of Minnesota really are stand on the shoulders of the people of the state. And so that's why I'm not surprised. I'm proud that we are where we are today, but I'm not surprised because it really speaks to the quality of the state and the individuals that are here. So far, through Mayo Clinic Labs, we have been able to expand with the University of Minnesota the testing capacity for the state for the molecular test to detect the virus that causes COVID-19. We've been able to use that to provide free testing to those that were involved in the social unrest, including the protesters, the first responders, and others. Volunteers, I meant to say there. We have also been able to get testing to where it's needed across the state. So a big part of this, is Commissioner Malcolm, said, is to make sure that we get testing where it needs to be, when it needs to be there. And so we've worked very diligently at that as a team. We, in addition, have been worried since the onset about how this would affect our tribal communities. So we've been getting testing to the tribal communities. And last but not least, the long-term care facilities have been a real focal point where testing is needed to stop the ravages of this disease amongst those who are most vulnerable in those facilities. A lot of this doesn't happen. I think it's very easy, even for many in healthcare, to underestimate the amount of work it takes to actually get a test from an individual, accurately perform that test, and then deliver that result back to them or their provider in a way that it can be acted on. And so a lot of the work in the early days was actually building an interface between the University of Minnesota and the Mayo Clinic so that our capacity, as we built it in collaboration with the state, could be seamlessly accessed by the citizens that need it. And so that was a great amount of work happening behind the scenes so that the people that need the testing don't have to worry about all the other aspects that go into that, which was really important to all of us that were involved in this work. But it hasn't been the University of Minnesota and Mayo Clinic alone. Every health system in the state has stepped up. It's challenging for them because, like many healthcare facilities, like many communities and companies and others, there is a sense that it's easy to get overwhelmed. And so Mayo Clinic and University of Minnesota have been able to provide that backstop or that safety net so that any healthcare system that needs to test people in their geography or in their reach, they can do that with confidence that if they get a surge in demand, that the university and Mayo Clinic will be there to help them through that. Now, as we pivot to reopening up the state, there are many others outside of healthcare who need the testing, who need access to the testing to safely do so. So we have been partnering with public entities as well as private entities and corporations to understand what the needs are of the people that work there or that learn there or that volunteer there so that we can help do everything we can with our state testing capacity to guarantee their safety or to at least make it as safe as we possibly can with the information that we have. So on top of that, so we continue to innovate. As Commissioner Malcolm mentioned, the supply chain, the global supply chain will continue to be stressed for the ongoing future of the COVID pandemic, because I really believe we're moving past a response to a management. So we're going to continue to need testing across the globe as this is a global problem. So we'll continue to work through the collaboration for the needs of the state, and not just for the current state testing, but also, as Dr. Shacker said, participating in the innovation and the research that will help us to develop the new tests that people need and the next phase of tests that people need to help manage this pandemic or get access to the treatments that they need. But the goal today and the goal in April was to really get testing up and running. A lot of work. Today, Mayo Clinic has provided 282,000 PCR molecular tests for Minnesotans. In addition, we have supplied 46,000 serologic tests today. So, and again, that's not a Mayo Clinic alone thing. That's Mayo Clinic in partnership with the state and partnership with the University of Minnesota. And more important than the numbers is that the people that need the testing feel that they can confidently get the testing. So with that, I will turn the podium back to you, Governor.
Well, thank you, Dr. Maurice and the Mayo Clinic, Dr. Shacker and the University of Minnesota, and to Minnesotans. We're really grateful. I want to be clear, we are certainly not here taking a victory lap. We're here to acknowledge what Minnesotans expect us to do, lay out a plan to protect public health, build the coalition and source the material necessary, then execute that plan to put us in a position that I think Dr. Maurice said something really important. We're going to have to learn to live with and manage COVID-19 for quite some time. So there was no quick fix. We certainly want to see the therapeutics improve as they have. We want to see us work towards that vaccine. But that's work down the line. In the here and now, we have to be able to respond. And I think some of the things we've seen with COVID-19, it certainly falls right into with our the social determinants of health that we see hit Black, Brown, and Indigenous communities, and the ability to test can start to level off some of that. An example this weekend is a targeted testing in our urban Indigenous population that we see much higher numbers in of positive infection rates. And those are all things that testing gives us the tool to start making sure every Minnesotan has that ability. So this was a goal laid out. We're there. We believe we have the capacity to maintain this for the long haul, for as long as it takes us to be in this. And that gives us a real advantage, I think, of keeping our economy as open as we can. And again, with the help of Minnesotans, manage it in a much more stable way than the overwhelming of our hospital capacity in our system. With that, questions, Tom?
Governor, I just want to maybe address this, and I missed it. You have the capacity to do 20,000 tests. But according to the chart, you haven't reached 20,000 in any given day. Does that just mean you have the ability to do that? It hasn't been the demand?
Yes. And it's a little of both. And Jan might mention this. It's a really great question because it was getting up the capacity, getting people into test, getting testing near them, telling people to come in and getting them processed is part of that too. So what we've seen is in some cases, and we hear those stories out there, people are being told, well, unless you're symptomatic, don't come in. We're encouraging people if they believe they need to be tested to get in. No barriers to it. We simply haven't got to that. We think now that people know it's out there, it's becoming easier to do. Those of you who tested early on, the swabs are not this long anymore. They're this long. And those things make a difference as we become more efficient. We think more people will come in.
Because we still get emails every day from viewers who say, I tried to go in and get a test, and they wouldn't let me do it.
I'm going to address this and have Jan address this. One thing I think that people need to know is that this is a very unique public-private partnership that we created together. I said this and still take responsibility, and those people who can't get them, I'm responsible to figure out how to get them to do that, the state being the lead agency. But the capacity, these are independent healthcare systems that are delivering these. And there may be a reason on a given day why they're not testing or why they're holding back tests for a different reason. We are still working to try and troubleshoot those where Jan talked about today. We need to have a place where people know if you can't get it at this healthcare system, this is a state-run lab or wherever it's at where you can get one. So Jan, you may mention on this because I don't deny that is still happening. It should not be happening because we do have the capacity to test up till 20,000. And at point in time, I think our largest was 17,500 on a given day. So Jan, if you want to.
Yeah, I think the governor hit the high points exactly right. It will vary from day to day, from clinic to clinic, what that individual site is able to do. And those are private decisions that the systems make. We at the Minnesota Department of Health issue guidance to say, here are our priority populations. Here's what we would like you to be testing. Our most recent guidance made it really clear that asymptomatic people should be tested when they believe that they've had a reason to think they may have been exposed, whether that was from participating in a large gathering or from somebody they know having been exposed. So that is the guidance. It confirms with what the Centers for Disease Control and Prevention has also said, but it's guidance. So each individual private entity makes its own decisions about their capacity and what their priorities are. They are putting a big push, rightly so, on testing healthcare workers, testing symptomatic people, testing people coming in for procedures of various kinds. And if they have all of that covered, then they're more able to deal with kind of community requests for additional testing. We have a website that you can link to through the governor's COVID-19 page, which lists where all the testing centers are around the state, and that information's updated daily. And so you can see on each site, what are they testing there at the XYZ clinic? And they might say, we are testing only symptomatic and pre-procedure patients, so that you would know then that that would not be a place you could get the test. But others say we're open for walk-ins, we're testing asymptomatic. Another thing that we have done and will continue to do is supplement where we see there are under-tested communities. The governor just mentioned the urban indigenous community testing this weekend. The 4 sites that were up for each of 2 days, each of the last 3 weeks, to offer testing to community members who may have participated in the mass gatherings. We'll continue to do that, to stand up special testing opportunities in locations where we know there's a need. But in the meantime, we will, as the governor said, continue to just try to problem solve with the health systems, make sure anything we can do through this Mayo University partnership to get them, the supplies that they're missing, so that they can test the full list of priority populations in as many sites as we can get.
Commissioner, next question. With respect to, in the course of a normal flu season, Christmas is around the time that people start gathering and mix up the germs and land get more influenza. Are you worried that this holiday is going to be the same problem, and that no matter what you're talking about here, we're going to have an exponentially increasing cases coming out of the holiday?
Well, that it is a concern that we know that there's more social gathering going on. We just keep on reinforcing the importance of distance first and foremost. Being outdoors helps a lot, and masking helps a lot. But yes, we certainly have seen incidents of people gathering in larger groups without social distancing and without masking, and that is a proven recipe for spread. And we have seen that happen in our own community, and we are certainly seeing it happen in some of the other states that are seeing these big increases now. So just the importance of everybody understanding that this is not only about whether do you personally feel at risk, or not only about do you feel ill, but it's about the potential, more than the potential, the fact of transmission between people that don't even know they have the virus and other vulnerable people. So we just need for Minnesotans to keep understanding that it's up to all of us, our collective individual decisions, whether we are able to achieve these goals of managing the epidemic, the pandemic, which is here and will be here for a long time. So to the extent anybody thinks this is over, as the governor keeps saying, it is most assuredly not. It is with us, it's in our communities, and it's up to all of us to do social distancing and mask wearing, to be outside as much as possible. And that's the good news. Being outside is a great thing. The risk of transmission outside the data is becoming more and more clear how much better that is, in terms of if you want to gather and you want to have fun, take full advantage of the good weather to do that. But thank you for the question, because I think with more gatherings, it's just so important for people to try to be really aware of what they can do to mitigate that risk. Thank you.
CDC last week used antibody testing, serologic testing, to say that for every 1 case, no one through diagnostic testing is probably another 10 cases in the country. Do you agree with that assessment? Minnesota, Dr. Checker, do you have any antibody testing data that would verify whether we're on that level? Just wondering what you make of that statistic.
I would very much like either of Dr. Shack or Dr. Maurice to comment on what they know, because they have been doing some serology testing under this partnership. We've been using that same 10 times multiplier in our own thinking for a while. So that does confirm or conform to what we believe is going on in Minnesota as well. But Dr. Check.
I think you said it.
So at this point in time, a lot of the antibody testing that's been done in Minnesota has been done on select populations. So we have we don't have a lot of data to say what the seroprevalence is across the entire state. And Bill, you might have some data as well from the Mayo serology testing. I can tell you that in our serology testing, where we have focused on healthcare workers, we focused on just general seroprevalence in the Twin Cities. It's about 4%, between 4 and 5%, and that's about what you'd expect given the number of positive tests that we have on any given day. So at this stage of the pandemic, for our population, those data gel and make a lot of sense to me.
Peter? Oh, go ahead. Dr. Maurice, sorry.
Sorry, Governor. Yeah, I mean, in our experience at Mayo Clinic, we talk weekly actually with Dr. Shacker and myself and others, and we had similar data. I do think that it's still very early days with the serologic testing to understand or to have enough data to really draw conclusions. And it will be part of the discussion of the partnership here as we go forward. I think how a serologic testing should be used to help manage the pandemic now that we're in the management phase will be really important, that we use the testing to generate the information that we collectively need to help go forward. So right now it's still pretty early days. Peter?
Yeah, no, it's a good point. That's certainly not my intention, but I do think when we have a 50-state strategy instead of one national strategy, we're trying to learn from states who are earlier in the pandemic, things that worked and didn't work. And I think it's natural that we do that. Not that, and I'm being very careful on the Minnesota exceptionalism in the era we're in of what we've seen in Minnesota over the last several weeks, and of course with the pandemic. But I do think there are some lessons learned, and what we've been saying the whole time, those that were declaring victory are ignoring the science. I mean, the epidemiologists and the epi curves have been very clear. I just have to admit, I was just most surprised that we weren't seeing the curves faster in Florida and some of these places that we are now, because the data just does seem to give it enough time, will shake itself out and get there. And I think our concern is that with the kind of quick fix, or that they were coming to an end and we could move forward, we weren't doing it in a sustainable manner. I've been saying since the very first time I talked about COVID-19 and we talked about stay-at-home orders, we can't isolate everybody for 18 months or 24 months till the end of this. We needed to find a sustainable management position, and a big piece of that was being able to know who had it, and that was PCR testing and the serology testing. And so we are comparing to some of the other states because I think there's a lot of pressure, and rightfully so. Open the economy. Open the economy. I've said all along, I am in total agreement with that, but we have to keep the economy open. People are not going back in any bigger numbers in Georgia than they are in states that were closed. The real fix here is for people to feel comfortable, and that's where I think this discussion, and I was on with the vice president this morning, where governors point blank asked them that you could change the trajectory of this if you and the president would wear a mask and tell people to wear a mask. And the response was relatively positive from the vice president, that we hear you on that. So I think I want to be careful of not comparing to other states, because each of us will be in that spot at one point or another, but there are lessons to be learned by states that managed a little differently. Yes, absolutely. And what I'm trying to get there, and we're working with people, the question being, do these spikes in other states? Yes, I think there's lessons to be learned there. Understanding one of the things, just very candidly, and Jan might tell you this, bars are hotspots. And I think there's people saying, wow, that's really insightful that bars are hotspots. Large numbers of people in close contact, talking loudly with no separation. So we're thinking about how do you manage that over what we've seen is outside, quite honestly, and youth sports and those things don't appear to be high transmission locations. So those who are thinking that if we're changing from where we were in March when we started this till now, yes, we are, because there's new data coming on board. And I think we talk about COVID time. Over the last week, it has caused pause for us to look at this and ways that we can get long-term sustainability. I mean, the data is pretty dramatic. If we had a 95% mask usage rate, they said from now until October, we would save 33,000 lives just with masks. So I think you have to start recognizing where's the cost benefit analysis for the decisions we make and what mistakes were made in states that could be corrected before we make them. And we're relatively blessed that we have been behind the curve that was coming since it started. We didn't get the early hit like Washington and New York State got, but then we did start to ramp up and stayed pretty consistent. The question is that how do each state's epi curves look different from one another? And when people are comparing state to state, I'm very cautious about this. It really determines your demographic and your population densities. Having a urban area of 3.7 million people with the Twin Cities area has a big impact on how things carry itself out. So yes, the answer is yes. We're assessing, we're trying to become more sophisticated. We're super sensitive to the economic growth that needs to get going, but I want to keep them open. Yes, sir.
Can you speak more to, there's been debate about how accurate these serology tests are. Do we know more about that now? And if they are accurate, is there a timeline when people should start getting those, or if that's part of the plan?
I'm going to let the experts take this one.
Yeah, thank you. That's a great question and a very reasonable one. There has been a lot of work in the lab testing community and the lab testing industry to make sure that the serologic tests are of adequate quality to make sure that we're getting good information from them to answer the questions people really want answered. It's a tough problem because the way any test performs is in part driven by the actual prevalence of the disease in the community in which it's used, including serologic testing. And so some tests which looked pretty good in the early days, when applied to a community where there was very low prevalence, actually led some people to believe they had antibodies to SARS-CoV-2 when they didn't. So there's been a lot of work, the University of Minnesota, Mayo Clinic, the FDA, industries, and so now the tests that are out there are very, very high specificity and sensitivity because we really want people to have confidence coming in and recognizing that if people aren't confident in diagnostic tests, that's going to be another barrier for them to actually want to come in and get tested. So been a really a very intense focus on that. And I think people can now be assured if they come in for a test, it will be a good one.
Governor, having said what you just did about masks,
yeah.
Have you given it any more thought to mandating masks statewide in Minnesota?
Yes, and we have conversations across the spectrum. I get it. The sense of a state mandate, whether it was a government shutdown or was bars and restaurants or was capacity in churches, all these things are difficult decisions to make. They were all aimed at doing a couple things: slowing the spread of the disease to allow us to build up our capacity, specifically in hospital capacity, ICUs and ventilators, but also our capacity to be able to test, and then to see what is most effective. And we're seeing it across the country. I heard Republican governors on the phone today talking about that they're exploring the idea of doing that. I would go back and ask again for Minnesotans that the best thing we can do is keep social distance, wear the mask, and if you're sick, stay home. That would have a bigger impact than any stay-at-home order I could issue. So this might be something that is worthwhile. And I hear from businesses, the businesses seem to think if the state mandated, it just makes it easier on them. They don't have to get into a fight with a customer at the door.
So how seriously have you considered?
It's part of the decision making, and I think as all these, and our administration has been very clear about this. I oftentimes say everything's on the table. That one's coming up. It has been around since the very beginning of this. I have watched this to see how effective it was. I tend to believe if you can. If you can use the carrot rather than the stick. But I do see a lot of places, and I just want to call this out and recognize that conversation, it has become much more of a political or an ideological decision than it is a scientific decision to wear the mask. And I'm making the argument of this: if you are for the economy opening up and for state to take away some of the limitations on your businesses, the surest way to do that is to wear a mask. The surest way to move us in the economy is to do the mask. So I'm serious about talking about it.
Just as a quick follow-up, that the American Academy of Pediatrics today talking about kids going back to school in the fall. They strongly advocate that all policy considerations for the coming school year should start with the goal of having students physically present in school. They say it's very important to their education. Is that going to be part of the decision making on that?
It is.
Require masks for students in school.
Yeah, no, this is all part of that decision making. And I am very clear about this, that students being out of school, me as an educator and me as a parent of a 13-year-old, they need to get back in that classroom. We know that they're not learning as much as they could in that classroom. There's certain segments of the population that are, but once again, now we're getting the racial inequities because of access to broadband and everything else. So yes, when we make those decisions to go back in, what will that classroom look like? What will the social distancing look like? What will the mask usage? Because we're learning a lot more about that it does make a difference. So the answer to that is yes. I think it ties into the earlier question. We are reevaluating now what we're seeing in other states, trying to provide new data into that equation and then trying to get it out. The time is running very short for us to have a decision about school to allow people to plan accordingly. The problem with COVID is the quick movement of it. So we're relying on the experts. We have been fairly accurate in predicting where Minnesota would be at in that potential peak. The good news is that we never really spiked out the top, and that's a real positive. Yes.
I understand that COVID covered care agreements with health plans are expiring tomorrow. Is that going to be extended?
Yeah, Jan, if you talk, you want. Yeah. Well, I'm just on this one. I'm going to have Jan come up on this. This is a tough one on care in general. And I think this is where some of the angst sprung up this week of two things, of those care agreements. And I want to thank the plans for all they've done to make it successful. That's coming up against the Supreme Court decision and the administration trying to take on the ACA. And so we are deeply concerned about what happens with coverage. We're deeply concerned about the care. I'm deeply concerned about a COVID infection being a pre-existing condition, because what we don't know about COVID. And I think here in Minnesota, and I'll let Jan speak to this, the partnership with the health plans has been spectacular, and their interest in making sure that people were covered was very clear from the beginning. So.
And I apologize, I didn't hear the beginning of your question. Were you asking about copays for testing or for care?
Well, I'm curious if there's a plan to extend that agreement. So if you worry, if it lapses, if people aren't getting tested.
Yeah, no, unless there's something new that I missed, the plans had already agreed to extend that their no copay strategy through, I think, at least October is the date I'm remembering. So as far as I know, we are still in the situation where the copays will be waived.
Anybody who's left their house in the last 3 weeks certainly seen that. So this is what I'm going to say. You can't do that as opposed to be forever.
Thank you for the question. And yes, the guidance is very clear that a bar needs to accommodate seating only, not standing in bars. There needs to be 6 feet of distance. And that is the current guidance, that there is an enforcement strategy where when complaints come in, that those are referred to typically local law enforcement to go and check out the situation, make sure that the establishment owner is aware of what the regulations are. We've been having conversations about how to make sure that enforcement and that guidance is taken seriously. We're talking about making it more clear to establishment owners what the consequences of failure to comply with the guidance is. A number of establishments have voluntarily shut down. What I was told as of this morning was that in the Mankato situation, they're now over, and there might be some double count here because some folks frequented more than one establishment, but they're looking at about 200 cases already in Mankato that are bar associated, another 100 here in the Twin Cities. And again, those are just the ones where there's already been a positive test. So you can just imagine, how many more people are out there possibly without knowing it, transmitting the virus. So what I can tell you is that we have had a lot of conversations with the hospitality industry about urging them to make sure that these messages are clear to the proprietors, because I do believe, as the governor said, they're interested not only in being able to open, but being able to stay open. And we've actually seen some pretty encouraging messages coming out from the associations themselves, really urging proprietors to be sure that the rules are followed, because if they aren't, and we see more of these kinds of clusters, that will absolutely call for stronger mitigation measures. There absolutely can be, and I think we've seen that in the Shady's Bar example in Stearns, that is one of the things along the way. And we have preferred to take an educational approach first, but we're taking it very seriously. Seeing numbers like this, that educational approach doesn't seem to be having all the impact that we want it to. So we're talking about things like making it really clear whether it's an environmental health worker or law enforcement goes in to talk to a proprietor about the consequences of non-compliance, that list is pretty specific about up to closure, revocation of licenses, etc.
Peter, I'd follow. Thank you, Commissioner. Your question is really good, and you're hitting around because this is a pretty hot topic. Texas bifurcated bars from restaurants and closed bars, kept restaurants open. I am concerned. I do want to echo the Licensed Beverage Association, Hospitality Minnesota, sending out strong guidance to their members to get this right, or we're not going to be able to stay open. We have moved way beyond the fight about liberties of Shady's Bar, and now we're figuring out if you gather in tight quarters, you're going to get people sick and get COVID, and we have to figure this out together. So I have no interest in not having them. And I will say, in one of the cases in Mankato, I personally ate at many of the establishments of the person who owns it. These are good people trying to do best. I'm trying to appeal to Minnesotans that the establishments themselves can set up guidance, but the people coming in there don't gather together without a mask. And these bars, yes, why they have a responsibility to tell people not to do that, because you're right. I know it's happening. I know they're gathering at the bar. You see the pictures where they're sitting there doing that. We have to be in this all together. And there's certainly the responsibility falls on the bar owners, but I don't want this to be that they're just bad actors and doing whatever they can do. I know that's not the case personally in the Mankato situation, but the people going in there and the inability to stop it is causing us a problem. And it creates a hotspot. And then what we all know is that spreads to the community. And while you personally might not be at risk of an underlying condition, others you come in contact with through second, third degree infections. So it's a good point. So I'm really, at some point in time, the carrot turns to the stick and to stop this thing. And I think that's what we're trying to get to. Than Wisconsin. So it's not as if you say that, oh, there's no stay-at-home order or anything, that the economy is going to boom again. There's a strategy of making it safe. And the bars right now are not safe. I mean, that's just the way it is. They are not safe when they act that way. And we do have to figure out. And there's a responsibility. I think your analogy is spot on, Peter, that if this were a salmonella poisoning situation, no one would be mad that we stopped in and stopped it from happening. But in this case, all of a sudden, you're taking away our freedom to get salmonella poisoning. No, and that's not what we're doing. And we're not taking away your freedom to get COVID-19, but we really need that help. And I do worry a little bit that there's some of these bar owners are trying really, really hard, and it's just not working. We got to figure out how to help make it work.
Governor, I've got a question about the number of deaths. Until today, we had an 8-day run, I think, single-digit deaths. I got a question for each one of you. Is it still about 98% of the people who are dying of an underlying health condition? Is one question. Secondly, Governor, for you, any second thoughts about spending millions of dollars on that more number of deaths going down something happened?
No, and I would say this. I would take.
Can you repeat the question? One of our viewers.
Yeah, for the rest of you, Dom was talking about the underlying conditions. Jan can answer that. I think that is correct. We went up to 10. This is the first day of double digits in quite a while. And again, one day does not make a trend, but we do watch that. So I still think the numbers still seem to be pretty plateaued. The second question was the facility, the morgue, for reaching the peak. No, and the reason I say this is the same thing happened last Friday. We took a tour with legislators on alternate care sites. When hospital capacity reaches at max, we knew that we had to build up for the potential to get to potentially 3,000 beds and ventilators. And if we reach that peak, I guaranteed that every person who needed a bed or needed a ventilator would be able to get them. And one of the ways to do that is alternate care sites. You saw in New York, it got rushed, so they tried to stand up the Javits Center. Well, once we saw them do that, my argument was I would not want my mother on a gym floor to be being cared for, or as they move people in to get the care they needed. So the model here in Minnesota was to go out and find 38 alternate care sites to stand up to this. Some of them make more sense. Hotel rooms that could quickly be turned into that, gym or dormitories. And then some of them were like the one that we had and we toured the other day is a former long-term care facility. And what we did is we validated that site. We did proof of concept, and within 72 hours, we can have 1,000 more beds. And then the next one would kick in, the next one would kick in. And what that is if we compare 10 states, Minnesota spent the least on this. Then the mortuary facility. The idea that Minnesotans would pile up as we started to see in New York or Italy, or the idea that we would not have the care sites, both from a health perspective and a dignity of life perspective, we made the decision to do that. And my hope is, and I told them at the long-term care facility and the mortuary facility, when this is all done and COVID is contained and we move to that place where we can look back on this time, if the critique is that I built that out and should not have done that, I will take that and own that, because I am simply not going to put it. I think it's like insurance. You don't ever want to use it, but if it's not there, and there were two decisions I made. One, that we cannot overrun our hospitals and not have the capacity. And two, we could not have people not in a dignified facility to treat them if we had bodies.
And then the underlying health condition.
I think that's still true, right? Isn't it?
Still 98%.
I will check on the specific quantification. It's certainly close to that. But the thing that has changed, I think, is awareness of underlying conditions and things like obesity being a risk factor and pregnancy. So the CDC continues to advise on a longer list of risk factors. So that's just something important to note.
One more quick question.
Sure. The question on the special session, no, not yet. We are working on it. I will say this. I spoke personally to Speaker Hortman and Leader Kent this morning. I called and talked to Leader Gazelka yesterday, and I was texting with Leader Dowd. And I think all of us understand Minnesota is still the focal point of the need to have trust in our police force amongst our community, talking about reforms that make sure a situation like the killing of George Floyd doesn't happen again. And then we have unfinished business around bonding and some legislative issues that will impact how we deal with COVID and how we deal with our economic recovery. So we have not talked yet. I know that there's still concern around, and we're trying to make the case around the emergency powers. I'm trying to make sure that we educate and work with legislators around what that means to have the emergency powers. And we should hope to have a decision. My guess is probably sometime end of this week or so. We have to start thinking about that, because I think the date we would probably be looking at is the 10th or so of July. All right. Well, thank you all again. And I would just say to Minnesotans, we're well positioned to handle this. As you've seen across the nation, COVID is a long ways from being done. I think there's reasons to believe we see other parts of the world have made decisions that have flattened this curve, got them way back down. We need to take the approaches that work. And here in Minnesota, one of those big ones was this incredible partnership and work of capitalizing on two of the world's great institutions, the University of Minnesota and the Mayo Clinic, coupled with probably the best healthcare delivery system in the other systems that were out there, and using the state's Department of Health to get this right. So now we are in that place where that moonshot is there. We're able to maintain this, and over the next, whatever it takes, 12, 18, 24 months, Minnesota is ready to tackle this issue of COVID in quick testing, quick contact tracing, isolation, and moving on. So thank you all.
That was Governor Tim Walz, some other health leaders talking about some important developments today. He kind of recapped the biggest point of the day, and that is that the Minnesota moonshot has been achieved. That moonshot was the ability to test 20,000 people a day. The governor cited the public-private partnership for making that successful and the ability to test those 20,000 a day. In terms of positive rates, of those, doesn't matter how many people are being tested, the government said between 4 and 5% of Minnesotans test positive when those tests are given. The governor said that 4 to 5% is actually a very favorable rate when you look at some other states, singling out Arizona. When it comes to mandating masks, the governor said that's part of his decision process for a statewide mandate. He said he's thinking about it and considering it. He said it's not so much an ideological issue, but he said if you want the state to reopen,